Okay. Okay. Hi, my name is Clark. I'm going to be your nurse today. I'm just here to perform a head-to-toe assessment on you. And while I check your wristband, can you please state your name and date of birth for me?
Anya Austin. My birthday is April 6, 2010.
Okay, thank you so much. And then I'm going to perform some hand hygiene, clean my stethoscope, and close the door to give some privacy. And then I'm just going to ask you, can you please confirm today's date as well as where you currently are at?
November 21st to November 21st, 2025.
And can you please tell me where you're at?
I'm at your house.
Okay, thank you so much. And now I'm just going to perform a general assessment looking at your appearance, your body build, your mood, as well as your speech. Patient appears to be a little tired, but overall calm. Mood appears to be calm. Speech is a bit quiet, but clear and easy to understand, and body build is consistent with patient's background. Okay, next I'm going to start a cardiac assessment of you. So I just have a couple of questions. Have you recently experienced any chest pain or tightness?
No.
Okay. Do you have any history of heart disease?
No.
Okay, and chest pain or tightness, history of heart disease, and have you recently experienced any shortness of breath?
Swollen feet.
Oh, yeah. Have you recently experienced any swelling in your legs?
No.
Okay, thank you so much. And then I'm just now going to inspect the 5 cardiac areas. Looking, maybe turn slightly just for me. Just a little bit, turn this way. Thank you. Just noting any lifts or heaves, looking at the 5 cardiac areas. The only one on the right side of the body is the aortic, which is located at the second intercostal space. On the opposite side of the second intercostal space is the pulmonic. Herbs is at the 3rd. Tricuspid is at the 5th. And mitral is also at the 5th, but at the mid-clavicular line. Okay, no lifts or heaves noted. So next I am just going to palpate, feeling for any thrills or pulsations in those 5 cardiac areas as well. None have been noted. And next I am going to auscultate using my diaphragm those 5 cardiac areas, listening for the S1 and the S2. Okay, and then I'm also going to palpate the apical pulse. Apical pulse is palpable. And then I'm also going to measure the apical pulse with the diaphragm side of my stethoscope for 60 seconds. Apical pulse is about 66 beats. Okay, and then from there I'm going to use the bell side of my stethoscope to auscultate the 5 cardiac areas once again, this time listening for any murmurs. Okay, no murmurs heard. Okay, and that should be everything for the cardiac assessment. So next is going to be the peripheral vascular assessment. So I just have a couple of questions for you. Have you noticed any skin changes recently? Any changes to your skin?
No.
Have you noticed any swelling in your legs recently?
No.
And have you noticed any?
I asked that question.
I know it's asked several times depending on the assessment. And have you noticed any sores on your arms or legs recently?
No.
Okay. Next, I'm just going to be turning your head to the right at a 30-degree angle. Or tilted. Thank you so much. So I can just look at your jugular vein. Looking for any jugular venous distension. There's none to be noted. Okay, you can turn your head back to normal now. I'm just going to palpate using 2 fingers the carotid pulse on both sides bilaterally. She's not in any pain. She just does not like to be touched too much. Okay, and then next I'm going to listen to the carotid pulse using the bell side of my stethoscope to listen for any bruits. No bruit noted. And then from there, I'm just going to palpate the various different pulses bilaterally. So the radial, with this hand. And then the ulnar. the brachial, the femoral, which is located on the inner portion of the thigh, the popliteal, the posterior tibialis, and the dorsalis pedis bilaterally. And then after palpating those bilaterally, I'm going to check the capillary refill of both all of the fingers as well as all of the toes. Can I see your fingers for me? Okay. The cap refill of the fingers and all of the toes is brisk. And next I'm going to check the temperature using the dorsal side of my hands of the lower extremities. Lower extremities are warm, and next I'm going to use the pads of my fingers to check for pitting edema by squeezing both the shins as well as the ankle and the feet for 5 seconds and then releasing to see how the skin reacts. No pitting edema noted. And that concludes the peripheral vascular assessment. Next is going to be the lungs and the thorax. So I just have a couple of questions for you now. Do you have a history of lung disease?
No.
Have you recently experienced any shortness of breath?
No.
And do you smoke cigarettes, vapes, or pipes?
No.
Okay. So next I'm just going to inspect the anterior area of the chest, noting any lifts or heaves. None have been noted. I'm also looking at the symmetry of the area as well. And then next I'm just going to palpate, feeling for any tenderness or crepitus. No tenderness or crepitus felt. And next I'm just going to check the tactophromidis. Please say 99 for me.
99.
Okay, thank you so much. Vibrations are symmetrical bilaterally. And then next, after palpating, I am going to percuss on both sides, percuss bilaterally on the anterior part of the chest. Okay, and resonance was felt in all areas bilaterally. Palpated, percussed, and next I am going to auscultate the area. I'm just going to have you take a deep breath in and breathe out when you're ready, okay? Okay. And then next, I'm going to have you turn all the way around. And we're going to do the same thing that we just did to the front, to the posterior side of the chest as well. Inspecting the posterior chest for symmetry, looking at the S-curve of the spine, checking the skin. Skin color is consistent with patient's genetic background, no lesions to be noted. Shoulders are symmetrical and posture is fine, no signs of any asymmetricalness. So next I'm just going to palpate the area, feeling for any crepitus or tenderness. No crepitus or tenderness felt. And I'm just going to check the tactophromidis. Please say 99 for me.
99.
Okay, thank you so much. Vibrations are symmetrical bilaterally. Next, I am going to percuss on all sides. Okay, resonance is equal bilaterally. And then after percussing, I am going to auscultate. I'm just going to have you breathe in for me and breathe out on your own. Okay, thank you so much. And then I'm going to check the 2-to-1 ratio of the anterior posterior ratio, which should be 2-to-1. It's 2 on the front and it's 1 on the sides. Okay, and then I'm gonna have you turn back around for me. And then I will be watching the breathing inconspicuously for 30 seconds to measure the respiratory rate. After doing this assessment, I can conclude that the breathing sounds are clear, are regular, and are unlabored. And that concludes the lung thorax assessment. Next, I'm going to have you lay down right here. This one is performed, the last assessment was performed, or sorry, not the last assessment, the peripheral was performed the last assessment was performed at a 90-degree high Fowler's. This one is performed at 0 degrees, so laying completely flat. And all I'm going to do is I'm going to inspect the abdomen, checking the patient's skin color. Skin color is consistent with genetic background, as well as looking for any lesions, no lesions to be noted. And I am now going to also be looking at the contour of the abdomen. It is flat and slightly rounded, no scaphoid or distension noted. And I'm also going to be looking at the umbilicus for any hernias, as well as its placement, its midline, and if it's inverted or everted, then the umbilicus is inverted. Next, I am going to auscultate in all 4 quadrants using my diaphragm. And then, listening for bowel sounds, I'm going to use the bell side to listen to the apical pulse. Okay, and then after that, I am going to percuss in all 4 quadrants using a zigzag motion, feeling for any tympany or dullness. Okay, and then lastly, I'm going to palpate in a zigzag motion in all 4 quadrants, looking at the face consistently to note any tenderness. Does this hurt at all? No. Okay. She's making faces, but she just doesn't really like to be touched. And I'm also feeling for any masses or organomegales. No masses or organomegales felt. And to do this motion, I'm using 2 hands and scooping. And that concludes my assessment.